Welcome to the Department of Health. You are now a part of the organization that works to keep Hawaii a safe and wonderful place to live. So what exactly is public health? Public health is a field of work that promotes and protects the health of people and the communities where they live, learn, work, and play. The key to public health is prevention and looking at health as a whole from a community perspective. While a medical doctor treats individuals who are sick, those working in public health try to prevent the larger population from getting sick or injured.
To me, public health is really looking at all the things that surround health. So not just medical health, but looking at how communities stay healthy, how we address mental health, social health, even things such as, housing, pretty much anything that affects someone's life affects their health. And I think looking at that on a broader level is really what we're trying to do.
In Hawaii, public health can have different challenges than on the mainland. Living on islands in the middle of the Pacific Ocean means time and distance are always concerns for supplies and assistance. Islands have limited land space and limited natural resources such as fresh water. And we are the crossroads for people coming from Eastern, Western, and Pacific Island cultures. From conducting scientific research to educating about health, public health workers strive to assure the conditions in which people can be healthy. That can mean vaccinating children and adults to prevent the spread of disease. If there is a potential for a disease outbreak, public health workers are monitoring and warning people to be aware and take necessary precautions.
What really has kept me in public health all this time is the fact that I think the work that the program does is really important. Disease investigation and disease surveillance and prevention are actually one of the core functions of public health. So it is already recognized as an extremely important and valuable part of public health. And I think what drives me is, remembering those times when we actually found the source of an illness and we were able to either remove it or stop it before it caused other people from getting sick. That's extremely rewarding.
Public health workers also promote wellness by encouraging healthy lifestyle behaviors that can affect everyone from babies in the womb to the elderly. Public health also looks at why some of us are more likely to have poor health, and we try to serve the populations that have difficulty accessing resources.
I think public health is so critical because we fill in the gaps and we help partner with all the different systems that make it essential for one to have the holistic approach. In other words, in Hawaii, we have all these resources because we blend all of our beautiful cultures together. But if public health wasn't here, then we would have all these silos and we would have breakdowns within all of the different systems. And what public health does is it kind of brings it all together. Public health fills in the gaps. Public health reaches out to people that maybe have been seen as the unreachable.
Public health workers are advocates for laws and policies to protect health and well-being. And most importantly, they provide science-based solutions that people can understand to help change behaviors.
We're often sort of on the cutting edge in terms of approaches to the problems. And if you can think back, for example, in occupant safety, if you can think back, say, 30, 40 years ago when seatbelts were used roughly half as much as they are now, where it just really wasn't a cultural norm to, when you get in the car, you got to buckle up. Whether that's because you've been educated to the point where you know it's good for yourself, or you happen to know that it's illegal to do otherwise.
Environmental health workers set safety standards to protect our land, air, and water from pollution. They also enforce laws to ensure our precious environment also stays healthy.
I think we all pay an incredible premium to live here. I mean, from the cost we pay for cereal to our property tax to not being able to own a home in an urbanized area. But what everybody pays that premium for is to be around family, but also to be around family in a really great place, that it's great to be outside. It's great to have beaches to swim in. It's great to have places to hike. It's great to know you're not being exposed to some kind of environmental contaminant in the ground that was left there from some big industry or some kind of spill. That is the kind of quality of life issues that we talk about, having the freedom to go and recreate in this great place that we live in. But you got to have someone to make sure that that remains, and that's really what we do. You know, and our programs are all designed to protect people, and it does that. It protects the people by protecting the environment, because those two are inexorably intertwined.
The key to public health is prevention, and to look at health from a larger perspective and see how we can all be involved.
So I started volunteering for a nonprofit called Headwaters to Ocean. It's a tugboat, and we took out school kids every day on the river, so I was an environmental educator, and taught them about how the actions of their daily lives affected the health of this river. It was really exciting, and it really connected me directly, made that connection in my own mind between what I do today, what I drink my coffee in, how I drive my car, all those things has a direct effect not only on me, but on the people around me and my community.
We hope you will enjoy working in this field that really makes Hawaii a better place to live. Mahalo for being a part of our team.